Hi, welcome to CARE Samvaad with me, Mirchi Hemant. Today I have Dr. Prashant Patil. Sir, welcome to CARE Samvaad. So nice to have you, sir.
Thank you, Hemant.
Yes, sir. Actually, there are a lot of people asked us a lot of questions, sir. So ఆ questions అన్ని నేను మీ ముందు పెడతాను. మీరు అవి ఆన్సర్ చేయాలి.
Okay, definitely.
సార్ ఫస్ట్ థింగ్ ఈజ్ అసలు కంజెనిటల్ హార్ట్ డిసీజ్ అంటారు కదా సార్, అది మరీ ఇండియాలో ఇంత కామన్ వర్డ్ ఎలా అయిపోయింది సార్?
No, it is common because it is the most common congenital heart defect we see in our practice. So congenital means by birth. So
Okay.
these are the diseases of the heart which affects the heart per se as well as the blood vessels. Okay, and it is the most common congenital heart problem across the world, especially in India, and it causes more morbidity and mortality, means like more deaths in India because of the congenital problems.
అండ్ సార్ ఐఎమ్ షూర్ యూ వుడ్ హ్యావ్ సీన్ సో మెనీ కేసెస్ కదా సార్. ఫ్రీక్వెంట్గా మీరు చూసే, అంటే విత్ రిగార్డ్స్ టు కంజెనిటల్ హార్ట్ డిసీజ్, ఫ్రీక్వెంట్గా మీరు చూసే ఎలాంటి సిమ్టమ్స్ ఆర్ ఎలాంటి ఇష్యూస్?
See, they present in two different setups. Okay, many of them are asymptomatic, completely asymptomatic. They will be detected only by the pediatricians, or they can present in the emergency situations where they will be blue, or they will have breathing problems, or the baby is not feeding well. So such kind of the acute presentations will be there.
ఓకే.
So we have two classes. So one is emergency patients, one are completely asymptomatic patients.
సార్ మై క్వశ్చన్ ఈజ్, పిల్లల్లో కిడ్స్లో ఈ కంజెనిటల్ హార్ట్ డిసీజ్ వస్తున్నప్పుడు కెన్ ఇట్ బి డిటెక్టెడ్ ఈవెన్ బిఫోర్ బర్త్?
Yes, it can be detected before birth because heart development happens in first 3 months of pregnancy. So it can be detected, usually in the second trimester. So we can do a scan around 20 to 24 weeks. That is called as fetal echocardiography test. And in that test, we can detect almost 95% of the problems.
అండ్ అంటే నా మేజర్ టెన్షన్ ఏంటంటే, ఇప్పుడు ఈస్ దేర్ సంథింగ్ దట్ ద పేరెంట్ షుడ్ లుక్ అవుట్ ఫర్, అంటే డ్యూరింగ్ ద బర్త్ ఆఫ్ ద చైల్డ్ ఆర్ ఆఫ్టర్ ద బర్త్ ఆఫ్ ద చైల్డ్ ఏదైనా అవేర్గా ఉండాలా వాళ్ళు?
It is a very difficult question because most of this congenital heart disease doesn't have any cause per se. So, out of 100 live born babies, one baby can have a heart problem. And there are no specific risk factors. So that is why usually nowadays, even the Gynecology Society advises fetal echo for almost all the pregnancies, including the high risk pregnancies. So there is nothing like high risk here. Even those families who don't have history of congenital heart disease, those babies can have heart problems.
Sir, you just said fetal echo, and which is fetal echocardiogram.
Yes.
Kaasta explain that, sir.
It is the test, like after birth we do the testing for the baby's heart.
Right.
That is called as echocardiography.
Okay.
So fetal echocardiography is the test which is done on the fetus to see the heart problems. So it is same ultrasound of the fetal heart.
Okay. And when you say early, how early do you mean? You said the 24 weeks.
Yes. So ideally, we try to do it at around 20 to 24 weeks. But it can be done early, like even around 16 weeks we can detect the heart problems. If the pregnancy is high risk, if there is a family history of some congenital heart diseases, we can do as early as 16 weeks. But usually around 20 to 24 weeks.
And also, sir, postnatal, ante after the birth of the child, I mean, how do you decide that inka idi surgery cheyalsinde, there's no other way out? How do you come to that conclusion?
So it all depends upon the symptoms of the baby.
Right.
Okay. Many patients which present in the emergency situations, like they are blue, extremely blue, or they are not feeding well, their breathing is very fast, they are not gaining weight at all. Those kind of babies will need emergency surgeries. While as those patients who are asymptomatic, so there are some certain specific timelines. Like if I have suppose the baby has a hole in the upper chamber, so usually we do surgery around 2 to 3 years. if the baby has a hole in the lower chamber, we do around 3 to 6 months depending upon his symptoms. So, every heart disease is different. Congenital heart disease is a spectrum of disease.
Right.
Okay, it is not a single lesion. So, every disease will have specific timeline.
And also, sir, they say catheter-based procedures. This is what I've been hearing a lot these days. So, in pediatric cardiology, in catheter-based procedures, how did they help you?
See, it helps in a big way because we are avoiding open heart surgery for the baby. Okay.
Please tell me, what is catheter-based procedure, sir?
The catheter-based procedure is the procedure. We go from the small vessels of the body, and we close the holes. We can open the walls, or we can open the passages. If they are narrow, we can open the passages with the balloon or stent. Okay, so if you go in 1990s, these procedures used to require surgery, open heart surgery. So now with advancement, we can even close the holes even in 1 kg baby.
Oh, so is this the same as minimally invasive surgeries?
You can say minimally invasive surgeries, but minimally invasive surgeries will have stitches as well. But in catheter-based procedure, the patient will not have any stitch.
So, if we go for that minimally invasive surgery, sir, how safe is it in terms of the surgery and also post that, the rehab?
See, it is very safe procedure. The risk involved in the catheter-based procedures and in the open heart surgery, if you compare, the catheter-based procedure is extremely safe. Okay, and in even postnatal course, if usually the open heart surgeries patients will have will need a ventilator, we will need a ICU care, we will have to stay in the hospital for 7 to 8 days. In catheter-based procedures, usually they are done under sedation. Means we will just give medicine for the baby to sleep and painkillers. And the recovery is so fast, like after 4 to 6 hours, the child can be with the parents, and in 1 or 2 days we will discharge the child.
Sir, ఎప్పుడైనా సరే the idea of babies having heart problems అన్నది it is very very upsetting for the parents.
Yes.
కదా అసలు ఇట్స్ లైక్ అయ్యో బాబోయ్ ఎంత పెద్ద ఇష్యూ అన్నట్టు చూస్తాం, విచ్ ఇస్ వెరీ నార్మల్ కదా. సో మై క్వశ్చన్ ఈస్, నౌ అడ్వాన్స్ టెక్నాలజీస్ చాలా వచ్చేసాయి కదా, అండ్ అందులో భాగంగా డివైస్ క్లోజర్స్ అంటారు. What are these device closures, sir? I mean, what kind of heart issues do you use these?
Okay. See, the first we need to understand what is device. Okay, device is the material which we put in the heart or the blood vessels. Okay, these materials are made up of a material called as nitinol. Okay, which is very flexible and which will attain the shape inside the heart. Okay, so usually most of the holes inside the heart can be closed with a device. Okay, suppose if the airway, some pathway is narrow, okay, like we say the main artery of the body, which is called as aorta, if that is narrow, we can open it with a stent. That is also made up of nitinol or stainless steel. Okay, so these all procedures are called device closure procedures.
And what kind of children what kind of children are suitable for this?
See, we need to evaluate all the kids, whether they are suitable or not. We have to be sure that this hole is not near to any critical structures. Okay, so similar like walls, okay, or if where the heart beats, like we called it as the pace, AV node or sinus node. It should not be close to that structure. So we evaluate on echo, as well as if we require, we do a CT angio or MRI, and then we categorize this patient whether they are suitable for the device closure or for the surgery. Not all patients will go for a device closure procedure.
So you're saying that ilanti procedures can be done on infants or very small children?
Yes. We even for 1 kg babies we can do a device closure procedure.
But will they have a long-term effect after that, sir?
No, it is these are the temporary structure which will close the defect, and then body tissue will grow over it, so it becomes permanent. So they are the permanent solution. They don't require repeated surgeries.
Oh. But however, sir, the moment you say congenital heart disease for a child, for a kid, or for a baby, it's very, very disheartening, very how do I say, heartbreaking for the parents
Yes.
కదా. మరి వాళ్ళకి మీరు ఇచ్చే మెసేజ్ ఏంటి?
See, I would tell all parents that the congenital heart disease can be treated, and these kids can survive. They can have a normal life as well. So they should get all their kids if the baby has a symptom, or if your pediatrician asks, you should get the child evaluated for the heart disease.
And also, sir, like you said, say there's a baby or infant, they have the procedure, they go with it. Post that, I'm saying the recoveries or a lifestyle changes, elantivi cheyali?
See, there are certain conditions where they can lead a normal life. Like, if there are holes in the heart, or if they have some wall problems, they can lead a normal life. There won't be any restriction for their physical activities, or there won't be any dietary restrictions. But there are certain heart problems where, if the chamber is not formed, or wall is not formed, they need a special treatment. They can need a multiple surgeries, and those kind of babies we will say they can do this much of activity. They can they should restrict the salt intake. So similarly, if the patient has a wall replacement, so we will ask them to avoid the green leafy vegetables. So similarly, but most of these babies, those who have a hole in the heart or the wall issues, they can lead a normal life.
They can lead us. So they don't have to worry about, ante chinnappudu I had this issue, so I went to the doctor, he operated, so I'll have a problem all my life.
No, not like that. Okay, they need to be under follow-up, but they can lead a normal life.
And also, sir, when we talk about, say, CARE Samvaad, when we talk about CARE hospitals, Banjara Hills, everybody looks up to the kind of technologies that are used
Yes.
in terms of solving people's problems, right?
Yes.
Medically. So in this case, with regards to children and with regards to, the pediatric cardiology. Yes. So tell me the kind of advancements in terms of medical advancements that have come through technology.
Yeah. See, the advancements are there in the surgical skills as well, surgical techniques as well, the intervention-based techniques as well. If I talk only about the intervention-based techniques, now that there are devices which goes from a very thin blood vessels, so we can close holes in the even 700 grams babies. Okay. Similarly, because of the advancement, the hospital stay is reducing, because we are using the minimal instruments. If you go by surgery, so we are treating almost all the spectrum of heart disease, like from only hole in the inside the heart, or in a child where the chambers are not formed, arteries are not formed. So we are doing the most complex operations as well. Okay, so all these patients, initially what was myth about the heart disease is they don't have a treatment and they require multiple surgeries. That is not there. Most of the kids can reach to the adulthood.
Sir, also with regards to say issues that health issues that people are having across all body parts, they say lifestyle is a major cause of concern. So when you say when someone is carrying the baby inside their fetus, please tell me the importance of the lifestyle of the mothers who are carrying the baby.
Yeah, definitely. Because mother carries two lives, means her own as well as babies. So obviously, during the pregnancy, they should avoid smoking, alcohol. They should be on the healthy diet. One of the dietary factor, which is called as folic acid, is responsible for both brain as well as heart. So if it is deficient, the incidence of the heart disease is more. They should avoid taking the drugs without any prescriptions, because many of the drugs can cause heart problems. If the mother has an infection, that should be treated. Certain infections have a high incidence of congenital heart disease, and as well, nowadays the stress. So the mother should be stress free. As well, there are the sugar, diabetes in the mother is one of the major cause for the congenital heart problems. So the sugars should be under control.
And also, sir, when a lot of these patients come to you and when you do their checking and everything, what is the frequent problem that you see that is very normal, but the women or the parents just oversee it and ignore it completely? What are those kind of problems that you see?
Okay. See, the most important symptom they ignore is if the baby is not gaining weight. Okay. So usually, there can be a nutritional factor, but most of the time it is a cardiac factor. As well, if the baby is getting fatigued early, okay, many mother says just he plays and he just sits down. So those kind of babies always should be evaluated for the heart problem. These are the main symptoms which are ignored by the parents. The symptoms which bring them to us is usually if the baby becomes blue, if the baby has a breathing problems, baby has feeding problems, like usually baby stops feeding in between, and baby becomes baby will have respiratory problems. Such kind of babies will come to us.
And generally, what is your answer to people who don't understand what you're trying to make? Or the moment you say we have to go for surgery, they go panic. So how do you face those? How do you explain them and convince them?
See, we always tell the heart problem in detail to them. We give them time to consume it. Okay, because if I say your baby has a heart problem or a hole in the heart, always they will be devastated.
The reactions are very wild.
Yes. So always we give them the time to consume it. We always give them the positive feedback, like most of these heart diseases can be treated, and they can have a normal life. Okay, at least near normal life. Then after certain time, they will consume it.
Yeah. Superb, sir. I mean, I really understood almost all of the issues with regards to pediatric cardiology and the kind of, care that one should take. But now I have another round that I'm going to go for, sir. So yes, now let's do the rapid care with Dr. Patil. Sir, you ready for it?
Yes.
Let's go, sir. First one. One myth about congenital heart defects that you always think people don't get it.
They think that congenital heart disease can't be treated.
Okay.
It can be treated and the patient can lead normal life.
It's a great news. What age was your youngest patient that you ever treated?
I have treated 6-hour baby. As well, I have treated 1.2 kg baby.
Sir, the moment you say 6 hours, it's so frightening, sir.
But if the baby has a LV, means the heart dysfunction, then we have to take them on an emergency basis.
Fetal echo or postnatal echo, which is more revealing?
Most revealing is a postnatal echo, because we can see the heart. Fetal echo has its own disadvantages.
Yeah. Okay. Best age for a child's first cardiac checkup, if asymptomatic?
If asymptomatic, after 3 to 6 months, because usually till 3 months they will have 2 holes inside the heart, which is called as PDA and PFO. Okay, so better to get the heart checkup done after 3 months.
What gives you the most joy in pediatric cardiology?
When a blue baby turns pink.
I can see the smile on your face.
Yes.
And also, sir, heart murmur, is it always serious?
Most of the times, and get your child evaluated by the pediatric cardiologist.
And how do I understand if it is heart murmur or not?
By pediatrician, because you can't hear the murmur.
I can't put my ear to
No. So it is heart murmur is always evaluated by the pediatrician.
Right. I mean, Prashant Patil, sir, thank you so much, sir. You told us so many things. And the most important thing is that we have to be aware. The next time any child is facing any problem, first get them to the doctor.
Yes.
Yes?
To the pediatric cardiologist.
To you. Yes. We will do that, sir. Thank you so much, doctor.
you.
Thank you so much. That was CARE Samvaad with Mirchi Hemant, and I had Dr. Prashant Patil on board today.